Hi, I'm Dr. Mike DiTolla. Welcome to the One Shade Show. Any dentist knows that there are 16 shades on a standard shade guide, but this is the show where we say to 16 shades, and we only talk about one shade, and its name is Universal. As a young boy, I could only dream of a world where I would never need to take out a shade guide for posterior composite restorations. And who, pray tell, made that dream come true? None other than Kuraray Noritake, the company that has brought us such game-changing legacy products as Panavia and CLEARFIL SE Bond. One has nearly eliminated post-operative sensitivity with our restorations, while the other has kept millions of crowns on short, over-tapered preps. And with the introduction of CLEARFIL Majesty ES-2 Universal, go ahead and set your mind to blown right now. The Kuraray principle is intelligent simplification, the process of making dentists more efficient with no loss in restoration quality. I know what you're thinking. Mike, enough words. Let's see some before and after pictures. All right, settle down. To see those cases, we're going to bring on one of the clinicians who has had the chance to put Majesty Universal through its paces for the last few months prior to product launch. Today's featured clinician is Dr. Jeffrey Hoos. If you haven't seen one of Jeff's articles or lectures or webinars, you've been hiding under a rock. Jeff practices in Stratford, Connecticut, and the name of his practice is the Brush and Floss Dental Center. Jeff, welcome to the One Shade Show. I gotta say, I love that your practice is called the Brush and Floss Dental Center. It's like you're telling patients, don't bother coming here if you aren't into oral hygiene. Tell me about how you came up with that name.
It's really very simple, but first of all, I want to thank you so much for having me. We've only known each other a half of a century, so it's so nice. It's so nice to be with you. It really started back in 1978 when I had an opportunity to work with a guy named Nigel, and we developed a program while I was at Tufts teaching preventive care for children who were neurologically impaired or psychologically impaired at a state school outside of Boston. It was the oldest mental institution started by Benjamin Franklin. And I started doing these crazy things like talking to them about brushing their teeth, and I would do brush your teeth, brush them every day, floss, plaque will go away. And I had these kids humming along. And so when I started my private practice, I used to write on the back of the checks, "Thank you so much, and don't forget to brush and floss." And then one of my staff members would answer the phone, "Hello, this is Isabel, Dr. Hoos's practice. Don't forget to brush and floss." And then one of my dear friends made a logo for me, and the next thing they were answering the phone, brush and floss. And then it just sort of evolved. And I have to tell you, it's really a very stupid name. But when we have patients that come in from the train from New York to come to Stratford, and they go to the taxi driver, "I'm going to see Dr. Hoos," they go, "Oh, you mean the Brush and Floss Dental Center?" And so it just sort of evolved from that. And quite frankly, hygiene is a huge part of our practice. It represents almost 50% of our gross. And so you're right. If you brush and floss, you get to keep them.
Yeah, exactly. And it's not that you're using it as a filtering technique. You're not saying don't come here unless you're interested in that, but you are taking a very active role, it sounds like, in educating patients. I like that it happened so organically, where it wasn't, something that was thought of as like a marketing plan, that it really had this kind of organic way that it just kind of happened and then it stuck. Well, as we get started here, Jeff, we like to let our viewers get to know you a little bit better by doing a segment we like to call A Shady Past. Now, I know every dentist doesn't have a shady past, and you probably don't. Just because some dumb friends of mine wanted to steal some gum from a liquor store when I was probably 11 years old. They ran and left the store with the gum. I was still stuck there in there. The liquor store owner grabbed me by the collar, had a gun in his hand, so I didn't go anywhere. And when the police showed up, they said, "What's your name?" And I said, "Michael DiTolla." And he looked, did a double take, and he said, "Is your dad a dentist over on Brookshire?" And I said, "Yeah." He said, "Well, your dad's my dentist, so I'm going to make you a deal. I'm not going to say anything, but don't ever do this again." And so that's my shady past. I don't expect that you have anything shady, Jeff, but I know you told me once that you were a good student in school, but that you don't have any auditory memory. And I never got to follow up on that. I don't know if that means that in your past, when you would hear something, you couldn't remember it and you had to read it. Tell me a little more about that.
So basically it comes down to the fact that I was actually reading before I went to kindergarten and was very proud of the fact that I could read and no one else in the class could. And I went through school, and one day in 7th grade, they did an exam where the teacher read the questions to the class, and I couldn't answer any of the questions. Totally embarrassed. My mother was in graduate school, and she was teaching or learning how to give this IQ test called the Stanford-Binet. And in the Stanford-Binet IQ test, they would read numbers in a sequence to someone and ask you to repeat them backwards. And I couldn't do a single one beyond 3, because anything over 3 letters, I cannot remember unless I see it. So if there's a hygiene check and my dental assistant or hygienist comes in and says hygiene check in room 3, within a few minutes, it's gone. It's absolutely gone. And so when I got to dental school, the amount of work that was there was overwhelming. And quite frankly, you talk about shady. It's sort of funny that I was watching some of my fellow students, quite frankly, cheating on an exam. And I thought to myself, maybe the only way I'm going to get through this is to cheat. I mean, how else am I going to get through this? So I went to see a guy named Forgione at Tufts. And those of us who went to Tufts remember him very well. And I said, Dr. Forgione, I can't do it. I'm falling behind. I'm at the bottom of the class. So he gave me a test. And he said to me, I have never met anyone like you. I go, oh, that good looking? And he said, no. He said, you have almost a photographic memory, but you have no auditory memory. So listening to a lecture, unless I'm scribbling down notes or drawing and doing different things, and that's why, quite frankly, I did very poorly in the beginning of dental school. But you show me how you want something to look, and that's how it's going to look.
Interesting. So I guess if you would have had today's technology, so if you could have recorded a lecture and then had it, translate into text where you could read it on the screen, or if it would have happened simultaneously, like if you could have had an iPad there, of course this was a lot of years ago before that, and you could see the words on the screen as they were saying them, you'd be able to remember it, because it does seem difficult for anything to be able to pass classes where so much is being explained. It seems like in anatomy, everything's in the textbook, and so your photographic memory would come in handy. But it also seems good too, like you seem like somebody who would be very able to forgive and forget. Because it's not like if your wife said something angry to you 5 years ago, if it was longer than 3 letters, which includes a lot of curse words are longer than 3 letters, it sounds like you would forget about it relatively soon if that's in fact how it works. So you're probably better at forgiving than a lot of other people. You've been nice enough to share with us a wonderful case that you go into detail and show us how you do this. So I'm really interested to see this case with you. Your first slide is interesting. This looks like maybe a central incisor that's been sectioned and then it's got some light going through it. Tell me about this first image we're looking at.
Well, so basically what we're seeing here is, and of course, I don't have the ability to do this, but someone provided this slide for me, and it shows that we know these teeth are not monolithic in nature. And how they diffuse light, and how we see light is reflection of light. And that's why that we know that colors are made up of 3 segments, hue, chroma, and value. But it's the natural differentiation of materials that make teeth look so natural.
Yeah, it really is. And even when it comes to shade taking, if you get like Vita's Easy Shade and you put it on the tooth and you do it, it's always right. It always gives you the correct shade. But as you move around on the tooth surface, you can get 7 different readings. And so unfortunately, teeth are far more complicated than we would like. We wanted to just be a shade tab, just be an A2. But obviously, as you can see here, it's far more complicated than that. So we're looking at, looks like tooth number 9. I don't know, is that a traumatic injury or what happened here?
So, this is a person that bit down on a paper clip and sheared off their tooth. So when we look at this, we go, how do we restore this? What do we do? And so when we look at the next image, we can see that the mistake that people make is they try to do straight lines in dentistry. If, a plastic surgeon will teach you, if you want to make an incision that's invisible, you need to make it irregular. So it's very important to make it irregular, and it's very important to take away the unsupported enamel. And so when we do that, I like to also use air abrasion. So I use something called Crystal Mark, but you can use a Danville microetcher. And I will tell you that I am not a rubber dam dentist. I've been considered a dam dentist, but not a rubber dam dentist. And so when you see I have a wet 2x2 behind there, and I'm microabrading that because even though I do want some kind of mechanical retention, but also I want to get the plaque off the tooth. Acid etch or does not, teeth don't acid etch when there's plaque on them. And then the next image basically shows that I'm using a matrix band backwards.
Is this part of your auditory dyslexia, that it's backwards?
Yeah, it's part of my auditory dyslexia. But so I have a very, very busy practice, and I like to do things that make things easier. So if you notice, I have the band backwards, and I have the patient biting into occlusion, maximum intercuspation. And so now, when I apply my bonding agent to the tooth using Quick or SE Bond, you'll see that I have brought my material, my universal material, behind the tooth, and I've had the patient bite down and slide forward so that I can see what's happening to the anterior guidance, because we know that anterior guidance is critical. And it's important that I can't do that with a rubber dam.
Right.
I mean, maybe you can, but I can't do that with a rubber dam.
No, that's a really interesting approach, too. This is like, instead of waiting till you've finished the composite, put everything and finding out, I got to take so much of this away. This is like a functional way to do it in real time and kind of have the patient trace that for you.
Do you remember years ago, functionally generated path?
Yes, exactly. That's what I was thinking of.
Right. So functionally generated path, it's not my idea.
Right.
It's something that I see in my mind that I'm going, wait a minute, I'm going to do a functionally generated path here, and I have the best articulator in the world. And what I'm doing is that I'm using my universal composite here, and I am sort of what I call a cutter downer. Mm-hmm. I'm a cutter downer. There are lots of people, they sculpt it, they lick it, they use all different kinds of materials. I sort of don't do that. I like having a bulk of material to work with. I'm not claiming I'm Leonardo da Vinci by any means, but when they said to him, how did you know it was there? It's in the marble. Right. It's in the marble. I just have to take away some of the marble to see it. So now there's my matrix band. We're in maximum intercuspation. And now what we're going to do in the next slide is we're going to basically fold it over. What's interesting, you can already see the refraction of light. You can already see the refraction of light.
This is how I know you're an artist, by the way, Jeff. This is because this is not the way that I can have success doing this. It reminds me, I try to go spend some time with my clinical mentors, and one day I had a chance to go see some of Bill Strupp's, preparations. Bill loves doing build-ups, and when he does build-ups,
it's like playing basketball with Michael Jordan. Right. You might get to touch the ball once.
Right. Well, the great part was, I wasn't even at Bill Strupp's office. I was at Danny Melker's office, his periodontist, watching him do this root reshaping procedure on a couple patients. And two of the patients happened to be Strupp's. And when he took the temporaries off, I could see all those perfect little, buildups on all the multiple teeth, and you go, oh, it's the real deal. He always does this, and when he does it, he just connects the entire arch with buildup paste and then preps the teeth out of it, and I just don't have hands or a brain artistic enough to do that. I need something a little more functional and less artistic, more paint by numbers. So when I see you do this and just cover the whole tooth, and now I know what you're going to do and be able to take it back, I'm saying now I know that you're an artist and you're not just saying that you are, because this is the difficult thing at this point, is reshaping this out of this whole mess like Leonardo did.
Right. So now what I'm doing is I'm using a carbide burr to bring it down, gross reduction. And so now what you're looking at, and I sort of show this because I like people to see that I didn't rinse away the aluminum oxide from the crystal mark. And so now you see me developing this tooth. And so in the next slide, I basically take myself with a little red pencil and I sort of look at it and see where the mamelons should be and sort of play with that a little bit. And then the next thing I do is I polish it up. And there's my final product. Now, what's interesting about this, when you look at it, notice it's day one. And I'm going to introduce a new term in dentistry called entropy. Mm-hmm. The best day of a composite is the day you did it. And so therefore, we have to understand that, when we look at these cases, we do these mega roundhouses and porcelain veneers. And I've always said, the best case to do an implant on is someone about 107, and the worst case is someone about 17. I am now seeing cases that I did 30 years ago, cemented with Duralon, cemented with Duralon, and I was pretty proud of those cases, and I showed those cases a lot. Those cases are breaking down. Porcelain's breaking. Why? Because it's entropy. It's entropy. So in the next slide, this is really critical. The critical portion of this is that when you look down from the incisal edge, that absolutely gives you the contours. It's a little trick. And notice the match of the composites. When you use a rubber cup on a tooth, use copious amounts of water, because those of you that are getting postoperative sensitivity is because you cooked the pulp. And again, showing the crest of contour. And so this is essentially the same case, but done in a compilation here.
Right.
And the key to this whole thing is that the unsupported enamel is taken away. Notice the wedge. The wedge is correctly placed. Most people put their wedges in correctly. You're not getting any mechanical advantage unless you use the wedge correctly. Overbuilt, and then cut down.
Hey, so just to your point about the wedge, most people would put it in so that the two long sides of the wedge were against the adjacent teeth with kind of the tip pointing up. And yeah, you have to push it in so far to try to get any kind of mechanical advantage. You've kind of turned it on its side so that one of those points is directly against that tooth that you want to move. Is that in fact how you're using it? Kind of more with direct pressure on the tooth?
That's exactly correct. Because in my mind, what I'm looking at is a way to move that tooth so I get a strong contact.
Right.
And if you notice that the material is mimicking, it has a chameleon effect, and so I can almost say, give me my material, give me my Majesty Universal, and I don't have to think about it.
Right.
Now, let's be clear. You cannot be all things to all people. But when we think about what most teeth are, then we know we have a small range with which we can work and be successful. Exactly. There are always the outliers. There's someone comes in with a C10, and there's someone that comes in with a triple X0 white. I did a case for a gal, a very famous woman, and she said to me before we started the case, I want you to show me the whitest thing you have. Now I want it whiter. So I actually had to go to Qatar. I had to actually work with Gene Chicha on this case. It was actually published. It was published a couple months ago, and we had to go to them and say, we need a whiter puck than you've ever made before.
Yeah, the one that you rejected because it was way too opaque, and you're just like, oh, nobody. This looks like a toilet bowl. Nobody will buy this. So just to finish up on the wedge, because I had never seen a wedge used like this before. Yeah, so we're taught to basically, for the most part, we're placing a wedge for two reasons usually: to try to get a little separation, but to also seal a matrix band in the gingival. And so we just assume that's always the way we need to do it. But if you're really just trying to get separation between teeth and you put it in as though you're trying to seal that gingival aspect of the matrix band, you're not going to get the kind of separation that you get there. So it's really great that you've taken this idea of a wedge that we commonly use in a certain way and say, well, no, we don't need to seal a matrix band here. We're not condensing, amalgam or composite down into that. Roll it onto its side and take advantage of that mechanical advantage of having it that way. So that's great. And it's amazing to me how well, in these two cases, we see this blending in, considering it's a universal shade. So it clearly picks up colors from around it, on the tooth itself. And I was really impressed on the case before how in the incisal third, where you actually where the patient bit on the paper clip and broke that off, it did not seem too translucent in that area.
And also remember, when you do your photography, if you don't own a great camera, you need to buy a great camera, because it sells more dentistry than you can possibly imagine. And you must not only show befores, but you must show afters. What's so interesting about the people that sell intraoral cameras, many, many years ago when Woody Oakes was selling intraoral cameras with Joe Stephen and Travis McPhee and all of that, really dating myself, I once said to them, why isn't anyone showing their afters? You're all showing your befores. And I had something happen in the office a couple of weeks ago. I treat quite a number of famous people, and I have no idea why, but I just do. And someone said to me, you're my dentist, her first visit. And I said, why? She goes, because you haven't made me feel bad about myself by showing me on a big screen above my head all the nooks and crannies and brown spots and leaking fillings in my mouth. They've been there for 30 years. And the key to this whole thing is our job is not to make patients feel bad about themselves, is to elevate our patients to feel good about themselves.
I thought it was to shame them about what they had going on in their mouth and, make them feel guilty. And if you went to 12 years of Catholic school like me, guilt and shame are very effective motivators. But maybe that's not the best way to get a patient interested and excited about what you can do for them in terms of their oral health. So tell me about this case.
This is a pretty terrific case. And the reason it's an important case to see and understand is someone comes to your office. Why have you come to my office? Well, I broke my front tooth. How did you break your front tooth? I have no idea how I broke my front tooth. I just broke my front tooth. And so when you do your analysis, you want to make sure that you look at the canine guidance. But if you look at the lower right slide, notice I've had the patient cross over the canine. Because if you look at the lower left side, it looks like you have lots of room to work. But you don't. Because when you do the crossover, you see that he goes into a deep, almost class 2 bite there. So that's important to note. So when we go to restore this, again, microabrading it. And then in this particular case, what I decided to do on the lower right is I added a product called Dentapreg. Mm-hmm. And Dentapreg is a glass material that is a fiber to help reinforce the edge of the tooth to get it a little more mechanical advantage. And again, overbuilding the tooth and then very carefully cutting it down, using lots of water with the rubber wheel, polishing it, and then you realize there's something wrong. And what's wrong? I didn't use the Majesty Universal. Oh. And it didn't pick up. And the value is wrong. And so now I have to do it over, because how the light is diffused and transmitted is clearly important to get the correct shade that we know, as I said before, hue, chroma, and value. But when it's the wrong value, it shows up like terrible. The courses that I teach, I always talk about balance in the art, science, and business of dentistry. When you have to do something over, you've lost money. That's bad business. Right. And so utilizing the right materials based on the right science allows you to do better dentistry with a good business model. As simple as that. And that's where Universal Majesty, or Majesty Universal, comes into play. And I think it's important for people to understand that's why we use these products.
Yeah, and I think it's important for dentists to understand that Majesty Universal isn't just a typical composite that's been around forever that's just had the shade adjusted to make it a universal shade. That's not what this is. It's that light diffraction technology. It's literally different the way the molecules are lined up in there, and light passes through it differently than it does a regular composite because it more mimics natural tooth, and it allows the composite to take on the surrounding dentition. Of course, the wider the isthmus gets, like on a restoration, now you've got more material in the middle that's not necessarily getting it from the wall. So like you said, it's not necessarily something you can use 100% of the time if you have this huge wide open, and you might not do a direct composite there anyway, but right. It's not just a regular composite. And so on that last case, had you used the Majesty Universal, it's got that ability to take on shade from the surrounding tooth structure, and it would have expressed itself through that restoration and been a lot closer match. You're the only KOL who I think has sent us a case of you not using the Majesty Universal and getting a bad result. But to your point, yeah, having to redo that now with the Majesty Universal, it's not great for profitability, and it's not necessarily great for, although it does look good to the patient that you're committed to getting the best result possible, but you would have rather done it, in just one session instead of having to redo it. And it's funny, that second to the last case you showed, I just want to throw in that I have the same thing that guy does. So when I get really angry, I bite together in this weird scissors bite where my cuspids do exactly that same thing. And that's how I've chipped 8 and 9 multiple times. And I don't even think about it. It's on a total subconscious level. And it's got to be something really infuriating, like the dogs. I told the kids to put, the trash bags outside up so the dogs can't get in, and the next day they tear apart, and I just walk back and I see this, and it's this thing where I bite together like that. And I notice my dad does it too. He does it sometimes if you're just telling him a story and he gets excited and he's starting to laugh, he'll bite together like that. So it feels weirdly genetic to me, like this might run in a family. But I've chipped 8 and 9, the mesial incisal edges, several times with that weird kind of bite. I've never seen it anywhere or anybody talk about it besides my dad and I. So thank you for making me feel like not such a freak by showing that case.
Well, look, we know you're a freak, but I will tell you, one of the biggest things you can have in your practice, and one of your number one practice builders, is you need a product called an MIRROR. And you buy them.
Is that an acronym?
You buy them. You buy the cheapest ones you can find at the dollar store, and you have it in the patient's lap. And when the patient holds up the mirror, you want to make sure that you're showing them the best restoration you can do. Because it makes me insane when someone will put in a central incisor, the patient holds up the mirror and they go, well, that looks good. The answer is never show a patient a restoration that is not as good as you can make it. Don't do that. Because immediately when we did this restoration, I said to this young guy, I apologize, I have to do this over because it's just not right. And he holds up the mirror and he goes, gee, Dr. Hughes, it looks pretty good to me. I said, there it is. It looks pretty good to you. And unlike in baseball, if you bat 500, you can play for anyone. In dentistry, if you bat 500, you're out of business. But you want to make sure you do the best quality work you can possibly do all the time, using the right materials based on good science. And you know what? You and I we couldn't develop a composite if we had 30 years to do it.
That's correct.
And that's why working with one of the best companies in the world, Kuraray, I know that I'm giving a high quality product that I don't need to think about. And that's what's important to me.
Yeah, this is a legacy company that's products like CLEARFIL SE Bond, Panavia. I mean, really game-changing products that either helped us get rid of almost all, if not all, post-operative sensitivity and kept on many crowns on short, over-tapered preps that probably wouldn't have stayed on had they been with another cement. And so that's what it comes down to, is finding companies who do that kind of thing, do the things you and I can't do, which is innovate a type of composite like this that's going to match virtually every posterior tooth and a lot of anterior teeth as well. Well, Jeffrey, thanks so much for agreeing to spend some time with us today and for not only showing us and sharing some cases, but educating us at the same time. It's the first time you and I have ever got to sit down for kind of a long-form interview like this, and I really enjoyed my time with you today. Thank you so much.
Hey, you're welcome anytime. Just remember, it's all about finding the balance.
It is about finding the balance. Thank you, sir.
You're welcome.
Well, that will about wrap it up for this episode of The One Shade Show. Remember, life gets easier when you only need one shade for your posterior restorations. Go to oneshade.show for more product information and to see additional cases by other great clinicians such as Steve Schiffenhaus, Troy Schmedding,
pulling out a lot of that
and Richard Young.
We put a little bit of resin.
So on behalf of Dr. Jeffrey Hoos, Kuraray Noritake, Practice Passion, and myself, I want to thank you for your time and your continued commitment to quality dentistry.